joining. Good afternoon and good evening. So today's session is on claims processing in healthcare space. So previously we had a session on claims processing, session one on basics. So this is going to be a little advanced and from the previous session. The agenda for today, it is, we will be reviewing, we'll go through all the, on a very high level, the session one recap. Um, and it consists of like how do claims flow on a managed care organization, claims validation and editing in detail, how do claims flow through a managed care organization, future of claims, and any consideration in building a claim processing system. So what we are going to learn in today's session too on claims processing is to build more knowledge on the claim processing concepts, some more detailed insights on the claims, what is the way ahead, right, for the future of the claims processing, and we'll also have some interactive discussions, Q&A as part of this today's agenda. So let me introduce the speakers for today with no further ado. MalarPriya and Anup Das. MalarPriya is working as a lead PA with nearly 9.5 years of experience in IT. She contributes as Techno Functional Business Analyst, worked as product owner, SME, tech lead, and also developer in the previous roles. Anup is a senior BA with 10 years of experience, and he worked previously for healthcare projects, especially on the provider and dental and real estate services projects in North America. So that's about the speakers. With no further ado, I just want to hand over um, to our speakers today. Over to you guys.
Thanks,
Thank you,
Harsha.
Harsha. So, in our first session, we have given a high level overview about what is claim, life cycle of claim types, yeah, and we also saw how the claims are funded and what is the basics of claim processing and adjudication, and also we have seen what are the key metrics to improve the claim processing session, but everything at a high level. So this session we are going to go deep dive in certain areas. So first, let me start with some persona introduction, and then let us go into the topic, how do claims flow to a managed care organization? Okay, so let us start with Alex, the claims coordinator. So Alex is from ABC Insurance Company. He is a which is a leading MCO, and he's a claims coordinator who is going to play a very important role in this claim processing. Now, the member who is the heart of claim processing. So the member Sarah and our Dr. Johnson. And here is our claim coder. So claim coding is a very important area where your natural language claims will convert it into code where your systems can understand it better way. Right. Now let us move into how do claims flow to a managed care organization. So it have to go by a doctor or by a healthcare hospital or a nursing facility or some other way, right? So how it is moving to a managed care organization is what we are going to see now. So here is Sarah. Sarah have some health issue. So she wanted to make an appointment to the hospital. So she made a hospital appointment. Now she is moving to hospital. Okay. But what this hospital did, so hospital sent a insurance eligibility inquiry to the insurance company, that is ABC Insurance Company, and ABC Insurance Company returned the response. So what is the response? What is the request and response we saw in our first session? It is 835, 837. You remember? So the 835, 837 message format is being exchanged, and the insurance eligibility was found. Now, Sarah can meet the doctor and they can proceed with their treatment or diagnosis or whatever it is. Okay. So now, insurance company, the Alex helped in all this process. Consider it as a manual process. So Alex is the one who is checking all the eligibility and sending it back. Now, Sarah is going to meet the doctor. So doctor's visit happened on the scheduled date, and doctor heard all her ailments, her complaints, what is the diagnosis to do, what is the treatment to do. So he have a document. He have captured everything. Now the next step is documentation. So doctor is documenting all the ailments, whatever the symptoms she have, and what are the problems she have, and what is the diagnosis. So he's documenting everything. Now very important step, which is documentation to codes. Here comes our claim coder. So she's going to convert all the documentation to the codes. Of course, it is an automation process, but for this flow, we consider all this manual things involved so that we can remember it better. So in documentation to codes, Sarah will convert all the documentation into the coding way. We are going to see documentation codes in detail. So we will explain it later. What does documentation to codes mean? Now, for time being, understand it like, okay, we are converting this natural language to something like a code so that our systems can understand it better. Now, after that, what happens? So codes to claim. Now we found out codes for each and every diagnosis, each and every treatment. Now we have to convert it to claim. So you found the codes, you fill in the claim with all these codes. Okay, so claim coder and claim coordinator will interact, and then they will convert codes to claim if they don't have the automation process, right? Now claims to clearing houses. Usually, it may directly go to the payer or to PBM or any third party vendor like clearing houses as well. If you have this flow, it will be involved. Otherwise, it will be directly submitted to the payer. Okay, so there comes clearinghouse validation. So clearinghouse will validate whether it have any missing information or anything, so that before sending into payer, we can correct everything, we can apply the edits, right? So that is what they have done. And then they are transmitting the claim now. So they are transmitting the claim to the insurance company. So here our claims coordinator there is to receive the claim. So the claim receipt and registration will happen. Now, the final thing is claim editing scrubbing. Remember here, claim editing or scrubbing is happening in the payer side. Okay, but I'm going to talk about one particular flow later. But remember, for this flow, I'm having the claim editing and scrubbing at after the claim receipt and registration, that is at the insurance side. But this is a flow where claims flow to a managed care organization. But here we want to just go deep dive in certain area like documentation to code, code to claim, and claim receipt and registration, claim editing and scrubbing. After that, we will see what will happen within the MCO. Okay. For this, I would like to invite Anup. Would you like to take it forward?
Sure. Thanks, Priya. Thanks for giving a good overview of how claims flow to a managed care organization. Now, Priya mentioned, there are certain steps which we will be deep diving into. Starting with documentation to codes, we saw that, Lara was one of the claims coder who was involved in this process. Okay, so as you can see, what is basically documentation to codes in detail? So medical coders review the documentation and assign appropriate codes to accurately represent the services rendered and diagnosis made. So these codes are typically, they follow standardized code sets such as ICD-10 for diagnosis or CPT or HCPCS for procedures, and there only we these standardized codes, payers can understand how much they have to pay for the services rendered, and any I will say what are the expenses incurred on these services rendered. So medical coding is an entire profession dedicated to turning these codes into document into appropriate coding standards, and which will explain what services and how many units of those services were rendered. And as you can see in this picture, there's a clinical document which is just describing something that the patient was found on imaging to have a dense fracture and other details. Now, this is not understood by the payers. They need those medical codes, you know, and we can see a description of how ICD code specific codes refers to what exactly the services are or what are the procedures are. So based on that, the documentation happens and the codes are mentioned in details. Now going on to the next step in detail of this, how exactly documentation to code happens. So Lara, as a coder, will select the diagnosis codes. For example, in the coding system, the IC10 is appropriate. Uh, it is a code for a specific service which is rendered, and as per these diagnosis codes, the procedural codes are to be assigned. Once diagnosis code is there, then the procedure codes has to be assigned to those diagnosis codes. And we can see that there are CPT, which is procedures codes, HCPCS, which is services and supplies not covered by the CPT codes. Evaluation, E&M coding, which is the complexity and the level of member encounter visit. Hierarchical coding category, HCC, modifiers, and EHR coding. Now, once all the diagnosis codes and procedure codes are assigned to the description that or the documentation that was provided in detail. Now, the coder, applies coding guidelines, do a thorough check, as per the AML and the CMS, whether all these codes are adhering to these coding guidelines. And once, that verification is done, then the coding conventions are applied. Okay. Now, following coding conventions to the specific coding systems can be used that is present in the system. And at last but not the least, ensuring that the codes are accurate. So the coder is going to do once more another round of review, cross-reference the codes with the members' conditions, the procedures, and the documentations on the services that have been rendered to ensure that there is consistency of what has been, present in the documentation. Now, once the code is, once the documentation is converted to the codes in detail, the next step comes is, codes are converted to the claims, which is then sent to the payer. So this is basically a claim preparation step. Now, what happens here is, based on the documented services and the assigned codes and the provider's billing department, on base of all these information, the provider's billing department prepares the claim for submission to the MCO. And this involves, compiling all necessary information such as member demographics, provider details, procedure codes, diagnose codes, charges, and this is typically, following an organized, standardized electronic or paper claim format, which is done, and required by MCO. Originally, these were submitted through paper forms like UB04 or CMS 500 in the US healthcare systems. But nowadays, it is turned into electronic codes like 837P or 837I, which has a lot more information in display, and it has much more clarity. So if a member, for example, is out of network and the doctor, might create a super bill or, an invoice of services that the member can submit to the insurance themselves to get it reimbursed. And this happens out of the claims procedural system that is done by the hospital or the provider services. Now, once this step is complete, uh, you know, uh, we will go to the last step. As we discussed, we will be focusing on specific steps is claim receipt and registration in the payer system. In the previous step, we discussed that the billing department for the hospital services or the provider services is going to prepare, this claim receipt. Now, what happens in this step, claim receipt and registration in payer system? So once that entire, document is converted to code and code is converted to the claims is received and registered in the payer's claim processing system. And subsequent to that, uh, the payer starts, processing all these documents, validating adjudication processes, payment determinations. All these processes are involved in this second step. Next, the third step is they generate an electronic acknowledgement. For example, ASC X12999 is a functional acknowledgement, or ASC X12 277 CA is a claims acknowledgement, and I'm giving here examples what is followed in the US healthcare system. Uh, and at last, in this particular claim receipt and registration step, the further adjudication and payment processing is done. Now, once all these are verified, claims adjudication, method comes into play, which we also discussed in our previous session. Any issues or errors or validation mismatches that are present in the receipt, that is acknowledged, and these are going to again assign to specific error codes, and these are corrected, and again this claim is coming back to the prayer for processing. So, these are the major steps that we will be, as we discussed, I showcased in the advanced session. Now, over to Priya. So she will shed some light on the next step on claim validation, editing, and scrubbing. So,
Yeah.
over to you, Priya. Thank you.
Thank you. So, claim validation and editing. So, we have seen the last workflow is what the claim validation and editing is, right? So, what is claim editing actually? So, claim editing is referring to the process of reviewing and validating the medical claims submitted by the healthcare providers to ensure their accuracy, compliance, coding, billing guidelines, or anything. So every time the payer will give you the implementation guide, companion guide, and everything. Okay, so based on the implementation guide and companion guide, you might have built your system already, or especially this kind of third-party claim editor softwares are available. If you have contract with them, you can use their API as well to find out if there are any mistakes or inaccuracy in your system. So what are the claims that you filled, right? So it will find out if there is any missing information in the procedure code, diagnosis code. For example, for diagnosis code we will use ICD-10, right? For procedure code we can use ICD-10 procedure codes, or we can use CPT or HCPCS code. We can use any other codes as well, but every procedure code and diagnosis code will have some mapping, right? For certain diagnosis, for certain diseases, you will have certain treatment that is allowed. For certain diseases, certain treatments are not allowed, right? So we will have some certain mapping. If you have provided some incorrect procedure code for incorrect diagnosis code, then claim editing will occur there and it will correct the codes. So in a similar way, the editing will occur in certain areas so that you can avoid this denials, overpayment, or underpayment. Especially it is to maintain the payment integrity. Now, what are the top methods used in claim editing? So I'm giving something which is, top methods. This is not the only methods in claim editing. There are so many methods, but I'm just giving only top methods. So the first method is line by line review. So where each and every claims will be reviewed line by line. So the name itself implies the same thing. Second one is medical necessity review. Is this really needed for this particular diagnosis? For example, um, if I have the devial septum, my nasal septum deviation, nasal septum deviation, then what is the necessity for me to do the rhinoplasty along with it? Right? I can just do the septal surgery, but what is the need for rhinoplasty? So if you are applying for both septal surgery as well as rhinoplasty, then rhinoplasty will get rejected, right? Only septal is needed. That is your necessity, not rhinoplasty. Rhinoplasty is not needed for you. So this kind of medical necessity review will be done based on the diagnosis as well as the condition, whether the treatment is necessary for them or not. And the second one is bundling and unbundling review. Sometimes, we need to group so many things and then report it, or sometimes we need to ungroup and report it separately. So I mean, in terms of diseases or the treatments I'm saying. So this kind of review will be done so that it can help you with preventing the overcharging. And the next one is documentation review. So as per the documentation, you will be given with a companion or supporting documentation. So as per the documentation, have we filled or not? Another thing. And then there comes the claim scrubbing. So claim scrubbing is using the automated software to check claims for errors, inaccuracies, or consistencies. That is what I was talking about earlier, that you can have some software to do the same. Okay, and then the third one is a coordination of benefits. Of course, that will be before you are sending this to payers, you need to verify whether we have coordination of benefits verification is there or not, or otherwise payer will also do the same thing. And there comes the final one is claim auditing, right? So claim auditing will not happen for every claim, so it will be selected randomly, selectively, just like how the normal auditing works. So it will be selected randomly to verify whether it have the accuracy, everything. Okay, and clean claim review. So what is meant by clean claim? Clean claim means without any errors. So how many claims are with consistency? How many claims are having inconsistency? So there we can find out what is a clean claim ratio. So if the provider is submitting lot of claims, but the clean claim ratio, if you take, it is just falling very low, like 20%, 30%, then what does that tells you? That it tells you that provider system is not correct. That is why they are submitting not so clean claims, right? So that will help us in understanding how to improve the system, or do we need to improve the system. Then there comes, what are the common fields where edits will be usually applied? Okay, there are in claim there are certain fields we should not touch it. There are certain fields where we can do the claim editing. So where we usually edit is member information, maybe the missing member information will be there, or insurance information, provider information, provider demographics like NPI, TIN, maybe there is a problem there, or claim details like date of service, procedure codes, and diagnosis code, service units, charges, and treatment notes, that is supporting documentations like medical records, x-rays, images, so there, if there is any mistake, we can correct it. But can any one of you tell me, like, where the edits should not be applied, or it will not be applied? You can think of your claims that you have submitted in your life. Think somewhere that edits should not be applied. No one should be able to should not change that, because it is submitted by me. No one should be able to change that. Any idea where claims will edits will not be applied? Anyone? Okay, then I'll show that where claims will not be applied. Member medical history. Claim edits will not be applied in member medical history, social or personal information, and non-billing related area where edits will not be applied because that is not needed anymore, right? So here are some areas where edits will not be applied. Now moving to the next topic, you see that you think about this scenario. You have a charge entry, you enter into the claim, you immediately sending it to payer. Okay, and the claim is getting flagged, and then the notification will be sent to the submitter, that is provider. And you may think that claim denial is the problem only for the provider, not for the payer. But that is not the reality. If lot of claims are getting denied and again it been submitted, it will result in an administrative burden, not only for the provider but also for the payer. So the best way to do the claim submission is charge entry and then have a claim editor. You can use any type of claim editing. Okay, and then check the eligibility verification and duplicates if any, and PA edits if any, operational edits, attachments missing attachments, and administrative edits, and quality analytics, and whether we are submitting the correct claims. Correct claims means correct as per the companion document or supporting document provided by the payer, and then submit for payment. So this is the way to increase the claim claims. So the main hero here is the claim editor. You need to have a claim editor. Maybe if you are following the manual claim editing, or if you are using software, that's the best way to use the software. That is up to the provider, but use claim editing to improve the clean claims. Now, let us move on to the next topic. That is, how do claims flow through MCO from here? So now claim reached MCO. So what happens after that? Anup, would you like to take it forward? You are speaking on
Sorry,
mute.
I was speaking on mute. Yes. Sure. So, thanks, Priya, for giving details on the claim scrubbing or cleaning part. Now, the previous steps were mostly on how a claims comes to a MCO. But here we'll be discussing how a claims flow through an MCO. Okay, so it flows through a series of steps which includes verification, adjudication, payment, reporting. And let me give you a detailed explanation of each of these individual steps. Now, in eligibility verification or benefit verification, so adjudication analyst from the member services liaison plays a very important essential role here. They collaborate to verify whether the member's insurance coverage is active, whether the service rendered are correct or not, and whether they are covered under the member's insurance policy or not. And if you recollect, we had discussed on a couple of matrices on the claim adjudication that was part of the previous session. This is one of the steps that is, included in the metrics. Next, moving on to coding review. And we remember coders, Lara, who was a coder in the previous scenario. So here, their role is very significant. And, they take charge of the coding review, where they thoroughly examine the medical codes assigned to the services provided or the services rendered in each of the claim. And using their expertise, they ensures that the codes are accurately represented against the procedures that has been performed or the services that has been delivered to the patient. Now, with the diligent, coding review helps maintain precise billing and reimbursement within the organization or the hospital, and preventing any coding errors that would lead to claims denial or payment discrepancies. The next step is, assessing the claims as per medical rules or medical necessity. Now, what happens here is, it is the documentation specialist who takes care of all these steps in this step and reviews the claims carefully to ensure that they align with a hospital or organization's utilization management rules and medical necessity guidelines. And in their expertise, with their expertise in documentation and compliance, they ensure that the claims meet, the necessary criteria for approval. Moving on to the next, step is the determination of the deductibles. And here, the allowed or the approved amount on the deductibles or co-payments, or out-of-pocket benefits. Everything is taken into consideration here through the eligibility verification, benefit verification, coding review, and assessment. Mm, After that, which they proceed to the claim adjudication. This is this step again comes under the purview of adjudication analyst and along with the coding expert. Uh, so they both of these people, from these roles work together to determine whether the allowed or approved amount for the services has been calculated with the deductibles, co-payment, and accordingly, update the out of pocket expenses for the member. Then the next step is where the EOB is generated. And after the adjudication process, the payments are determined, system generates the EOB, which is explanation of benefits. Now this document is instrumental in helping members understand the breakdown of the codes, what portion they are responsible to pay for their side, and what is going to come from the providers or medical services or from the hospitals and the payers. Now, the member services liaison, that particular person who has that role, ensures that the members receive their explanation of benefits and assists them in interpreting the entire information and helps them understanding, of the details, of the details, what payment is going to happen from their side. And lastly, as we had discussed, payment processing and reporting is a very essential step here as well. So once all these steps have been taken care of, the a payment authorization specialist comes into play and takes charge of authorizing the payments to healthcare providers promptly and accurately. Once the payments are authorized, communication is sent to the providers, payers, and to the members of what has been approved and what not has been approved. And once the payment is confirmed, then it is the responsibility of payment authorization specialist to facilitate a smooth financial transaction. And once this clarity comes into play, this helps foster a lot of trust and improves the payer, provider, member, and other vendors involved. The relationship is improved. At last, once the entire step is completed, very important is reporting. Finally, claims processing has happened, reports are generated, and reporting experts who have a vital role to play in this particular step, use analytics and provide valuable, insights into the claims processing performance on what went well, what went okay, and what went bad, and what can be improved. And with the help of these reports, the organization or the hospital or the provider services, they track the trends, identify areas of improvement, ensure that in the futures the claims are going to flow efficiently and smoothly. Now I'll be handing it over to Priya to give some more deep dive into how claims flow through MCU. Thanks. Over to
Thank
you,
you.
Priya.
Thank you. So let us go and deep dive in one particular area, that is payment determination, which is a crucial part. So here, the MCO claim processing system, it will have a comprehensive database. The database will have contain, provider contracts and fee schedules and reimbursement rules for each provider contract within the insurance plan can be one plan, but it will have some contract with multiple providers, right? For each provider they will have a separate fee schedule, separate reimbursement rule. There will be some kind of separations, like, okay, this is preferred hospital, this is specialty hospital, this is non-preferred hospital, and some hospitals are not at all covered at all. So if you go to each different hospital, you may get a different payment. You may need to pay a different, some amount is different, right? Why? Because they are maintaining those kind of separate database where they are maintaining everything. And once the system applies the contractual rate and fee schedule and reimbursement methodology to calculate the allowed amount. But to do that, they will access the procedure code, and procedure code need to be accurate and correct. First, it will go through the normal claim verification, and then only it will come back and they will calculate the allowed amount. Let us take an example and see how it is being calculated. Okay. So first, let us see that the claimed service is service Y and provider is provider B. So here is our database from our payer system. So we have multiple providers and multiple services. You see the fee amount will vary between each service or each provider as well. This is how the database is maintained. And also what is allowed procedure code for particular service. For X, only 99214 is allowed. For Y, there are two procedure code which are allowed. Okay, but here what is our claim? Our claim is service Y. So service Y, and our provider is provider B. So B and Y. So this is the row. So our fee schedule is 180 and the service cost entered by the provider is also 180. Now the procedure code on the claim is 99214. Do we have 99214 covered by the service Y? We have to go back and check the procedure code. Do we have 99214? We have 99214. So 99214 is a valid procedure. So this claim is verified. Now it will go through the adjudication. For adjudication, we need to know what is the copay and deductible for this member for this insurance plan. So we have another information. The copayment is $20. And they have to pay for every service they get. They have to pay $20. Okay, and the deductible is $50. What is deductible? Deductible is some amount that patient have to pay from their own pocket before the insurance is getting started. For example, the insurance will get started after you spend your own money for $100, because you have some illness that is more than $100. Then only your insurance will be applied to you. So something like that. Okay. So the deductible amount is $50, copayment is $20. Now we have to calculate what provider will be paying, what member will be paying. Okay. Let us do this calculation. So the first thing that we verified is procedure code valid for service Y. So the claim is verified. Now the contractual rate is $180. The copayment is $20 and deductible is available. It is $50. So first, the member have to go through the deductible, right? So the deductible will be 50. For $50, member have to pay for sure. Then what is the remaining amount? $150. So out of $150, $20 will be paid by member because that is their copay. So what is the rest of the amount? Rest of the amount is $110. So the payer pays $110, member pays $70 because combining the deductible and copayment, so they will pay $70 and the rest of the amount will be paid by payer. Now if we have time, I can give you another procedure code, another fee schedule. Now you can also calculate, but given the time, I'm just moving forward. And the next step is, so now the payment is determined. Payment is determined, what member owes, what payer owes. So everything is determined here. But if it is a government plan, then the manufacturer discount may get applied and government subsidies will get applied. Then that's another different calculation. But we didn't complicate, we just took a simple path. But in reality, there are so many things that will get applied and then only this amount will be calculated. Now, moving on to the payment processing. Okay, so first, the payment is determined. EOB will be sent to, remittance advice will be sent to the provider, right? So the provider will receive this advice and they will reconcile to verify whether it is accurate, the adjudication outcome is correct or not, or do we need to again appeal for it? So they will they will do their own reconciliation. And then they will submit for payment authorization and request submission. Then the healthcare provider will submit their necessary paperwork or electronic authorization to request the payment from payer. Now the payment will be processed by MCO. So first they already determine the payment amount. Then they will develop a remittance advice will be generated and the payment will be dispersed. Now the provider record need to be updated and then finally they will get the EOB payment reconciliation and everything. So again the provider will verify whether we received the correct payment or do we need to again appeal for that and etc. So after everything, the finally member will also receive what they have to pay as well, and then everything will be done. But if it is a pharmacy scenario, right, everything will happen in seconds. So they cannot wait for long, NCPDP, we had NCPDP. So everything will happen in seconds and you will get the member billing and payer billing, everything. I mean, what the member billing is, everything will happen in seconds actually. And moving on to the EOB part. So we were talking about EOB a lot, but what does the EOB contains? I have just took a snapshot of first section of EOB only, but EOB is too big. There are actually 18 sections in EOB. So I have taken only 6 sections for this talk purpose. So the first section that you are seeing is insured individual information. That is the name of the individual, policy number, address, the demographics basically. And then the second section is provider information. So in the provider information such as NPI, that is the basic, and the claim details. So claim details such as the date of service, procedure codes, and diagnosis code, and number of units served, and all this information will be there. And then the charges, the allowed amount, adjustments, denials, if any. If there are denial, then they need to provide the denial reason as well. And what is member responsibility, what member owes, like co-payments or co-insurances, deductibles. So what is the amount that member owes and what is covered, what is not covered, and what insurance will pay, and what is your out of if you have the MOOP calculation, so what is your out of network benefit as of now, and what is remaining, like what is consumed, what is remaining. And if you have any cob as well, if you have more than one insurance, then even that cob information need to be provided in the cob section. And other than that, provider reimbursement summary will be there, member summary, and explanation of codes. So here they are using lot of codes, right? Then there will be kind of appendix section where each and codes and remarks and everything will be explained in very detailed way. And there will be contact information as well where you can contact the insurance and verify if there is anything that is missed. So everything is part of EOB. Remember, EOB is not a bill.
it is just an explanation of benefits. Now, moving on to other section, which is considerations in building the claim processing system. So if we are trying to build claim processing system, what are the blocks that we need to think? So I'll give it to Anup.
Sure. Thanks, Priya. Thanks for giving a deep dive into how the specific steps on how claims flow through an MCU. Now, when we think of building a claims processing system, there are multiple challenges or drawbacks or advantages that comes into play. And as a member or a hospital or a provider or as a payer, everyone strives to build a better system which provides better services, better clarity, low errors, less grievances, less discrepancies. So I will not go much, deep dive into this. I'll just give a high level overview of, the building blocks that you can see. Regulatory compliances, and these come from, state level compliances, center, federal level compliances, then coverage verification, coverage that has been provided to the members or patient or as part of the hospital services provided, contract and fee schedule management, EDI integrations with other insurance providers or compliance systems, real time adjudication, and this is the next thing in the claims processing system, which is inclusion of AI or blockchain. Then coordination of benefits, which already Priya gave a good overview in the last section. Fraud detection and prevention. The more secure and the more robust we are trying to build the system, frauds are also increasing at that rate. So this is another place where the system needs to be better. Claims auditing, whether the claims are going through the proper steps, whether they are going through all the compliances, and this step is also going to help build a better system which provides better services in terms of claim processing. Appeals and dispute resolution, provider and member portals where providers and members can give their updated information, third party systems, and which is going to help the claims processing system or the payers to have updated information, and which will help the processing of the claims much faster. Data security and privacy, again, HIPAA rules comes into play here. As per the US healthcare system, training and support, not only to the members or providers or to the individuals who are doing it part of as a claim system, it goes to the payers also, because everyone needs to be updated of the compliances and the course that has been taken care by to all the conversions that is happening. Cost containment, the better the claims processing system is, the less cost it is to maintain it. Medical review and utilization management, and we discussed this point in the previous stay. Integration of base care, value-based care models, compliance and grievance management, and this is done through bringing surveys or feedback forms into place. Automated denials management, and this is also going to be the next step in the claims processing with the help of AI or blockchain. Analytics and reporting, which we already discussed, the step in how claims flow through MCU. And scalability, the last step where we can build a better claim system which handles parallel processes much faster and in a much efficient way. Now, moving on to the next slide, what is the future of claims? How claims is going to evolve, or how it is going to get better in terms of the technological advancements that is coming into play in our day-to-day life nowadays. Automation and AI, as we mentioned, how of in the previous slide, how to build a better claims, automated denial management, automated claims adjudication. So there is an example like Olive's AI claims automation platform. Which is upcoming, uh, I will say, claims management system for including AI as an automation, real time adjudication. Example for this is Change Healthcare's real time claims adjudication. We also discussed on blockchain for building a claims system. Guard Times Healthcare blockchain is a real time example in the market today. Prevention of fraud and better analytics. So this is Cotivity's fraud detection analytics. This can be implemented in any. You can take the integration and implement it in building a better claims processing system. Value-based reimbursement models. An example is United Healthcare's value-based care initiatives. Enhanced member engagement. Aetna's Health app, which is one of the leading, provider insurance companies in US markets. Interchangeability and data exchange, and now this comes again into integrations. Example is Commonwealth Health Alliance. Real-time analytics and reporting. Very good example in the market is Cerner's Health Analytics. Integration of virtual care, claims. Now, this again supports our integration on building a better claims processing system. Example is Teladoc's Health's virtual care solutions. Uh, so this is, some of the emerging products in market, and based on these pointers, the claims process system and the claims processes are going to evolve, each day and provide better, services in terms of whether it is processing or adjudication to the members, providers, or all the, third party members involved. So I think that's it for today. Thanks everyone.
Thank you. If you have any questions, please post it even after the session. Thank you everyone for joining. Have a nice day.
Thank you all.
Thank you.
Thanks everyone.
Thank you.